Okay, so Salam Alaikum. So we will start our lecture, which is steps of an outbreak investigations. So the outline, we'll talk about the steps of initial outbreak investigation, which include 10 steps. Then we'll go to the steps of follow-up investigation of an outbreak, which include 4 steps. These are the 10 steps, and we'll start with the first step, which is verify the diagnosis. So this step, you should accurately know how to identify the specific nature of the microbe. So you need to know the type and the subtype of the organism. So first, you should ensure that the diagnosis is correct. You should evaluate if there's any laboratory errors that can affect the diagnosis. You should also evaluate the possible changes in the case definition or the surveillance definition, and then review the clinical findings and microbiological testing results. For the second step, you should know if this is an HAI, an outbreak or not. So you need first to confirm with the lab to see if this outbreak happens at even in a community setting or in a health acquired setting. Also, you can use the help of surveillance data that can confirm the cases. So, as we see, this step it can be important to for any clinical procedures or diagnostic procedures and to prescribe antibiotics for the patient. So we should also consider one of the definitions, which is pseudo outbreaks. It means that if there's any process while taking the sample, if there's any contamination of clinical diagnostic equipment such as bronchoscope, this also need to be investigated, so it cannot harm the decision taking so that it can be effective for the patient. For example, we should not it will help us to not prescribe any unnecessary antibiotics or to do any unnecessary diagnostic procedures. So this step should be not evaluated only by the definition, but also how to actually confirm the diagnosis and how to take the samples. The third step, which is alert key partners about investigation. So it's important to alert these the ones who I mention to so they can help to proceed with the investigation, and there should not be any delays. So the people who should be included, which is the hospital epidemiologist, which can help in identifying the nature of the microbe and can of the outbreak, and can help to identify the location and the nature of the outbreak. Second is the infection control practitioner, which can help in distributing the infection control precautions measurements. We have also the environmental service department staff. We have the medical staff, administrative leaders, media relation director, and department leads for the affected facility area, and national public health officials. Also, the lab should be notified to isolate the samples that are related to the outbreak. We also have to notify national partners if the investigations involve regulated medical devices and products. Step 4 is to establish case definition. So the importance of establishing case definition is to know the people who are related to the outbreak. So it should be broad enough to include most of all, not all the cases, the case definition is used to identify the persons who are might be who are might be or they are actually diagnosed with the disease, and to characterize them in relation to the disease by time and location of exposure or illness onset, and other persons who are affected. So this is the importance of case definition. Case definition should be include clinical information about the disease, which is the laboratory test results, so signs and symptoms. We need to know also the demographic characteristic of affected patient. For example, the age, the race, the sex, and the occupation. We also need to know the location and time of possible exposure, time time of onset. Uh, so can help us to know actually where is the location, and also help us to know the nature of the outbreak. Establishing case definition, it can help us to go with the patients in three different ways. Even the case is confirmed, which is usually must have a laboratory verification. Probable usually has typical clinical features and an epidemiological link to confirm cases, but there's no any laboratory confirmation. Possible, which is usually has fewer of the typical clinical features or weaker epidemiological links to confirm the cases. So it can as I say, make it simple. Confirmed, it will be confirmed by the lab. Probable, the patient has the signs and symptoms. He has the epidemiological link, like the same location where the exposures happen, where the outbreak happened, where the exposure begins. This is the probable. The possible, the patient may have some signs and symptoms, but there is no any epidemiological link or any laboratory confirmation. Step 5, which is organize data according to person, place, time, and size. So to actually know who the people who are included, how big the outbreak it is, you should do two things in this step. First, you should create a line list and construct an epidemic curve. So the line list, it's it's like using a spreadsheet program, X with X using Excel. So it can help us actually to sort the data easily, and it can help us to analyze the data easily, and can guide us in the outbreak investigation. So the data that should be included, or the information should be included, which is the location information, demographic information, clinical information, and risk factor information. And this list should be updated and should be followed up, so it can help us continue the investigation. So the data that should be included in the line list, we have the patient characteristic, date of admission, date of illness onset, date of discharge, facility, location, unit, medications, procedures, the consults like from the laboratory or nursing, attending healthcare personnel. So these things, and most importantly, the date of illness, date of admission, date of taking the sample. These things can help us to know where to begin to investigate, where we can, and where the places that we should look for, and can help us also to have a contact tracing to know the patient who are the people who are also have a lead or a relation with the outbreak. So the idea of the epidemic curve is that we take the outbreak day by day, week by week, or month, so we know how its nature. So we can see if that it can help us to know, as I say, the nature of the outbreak. maybe it comes from a common source. So we see that there is a part of a period like a days or weeks that we see a lot of cases happen at this time. So we consider an idea about that. Maybe it can be distributed uh, in a way that, okay, we'll see that in first week we have 10 cases, in the second week we have 20, maybe after a month we see that we have 30 cases. So this type of curves that I will talk about in the next slide, it can help us to find or focus our questionnaire about this uh, outbreak, and it can help us to know how exactly where's the source, how it can be transmitted, if the transmission, what is the kind of transmission, and how we can stop this transmission. See, first we have the first type of epidemic curve, which is common source epidemic curve. We have the common source. It can be in two curves, maybe a point source or a continuous source. So point source, you will see that there's a single exposure that happened in one occupational period time. So for example, food poisoning from a single contaminated meal. So the food poisoning is not affecting other places. It only contain only one meal, for example. So we will see that we will have a sharp peak at one point, then the cases, it will be gradually decrease because we know the source and we can control it. It is an easy source to be controlled. But if we go to the continuous source, its exposure occurs over an extended period, causing a gradual rise and plateau rather than a sharp peak. So for example, a contaminated water supply. The water supply, it can spread all over the, for example, the region or whatever. So it will have a rise. It's something hard to control, but we know the source that it's only come from one place. The propagated or progressive epidemic curve. It mostly occurs when the infectious disease is spread from person to person. So you see that the the curve, it will be progressed, shows a series of progressive larger peaks as transmission continues over multiple generations. So for example, we see the flu. So we'll see the first time we see uh, at this moment we have like 30. It will be, then it will be, there's a cut, then we will see that the curves will be more higher, then will be a cut, then will be more higher. Epidemic curve, it happens in irregular pattern. So we will see that there's a period of time we will have high cases, then a period of time we will see fewer cases. So it happens mostly in a seasonal outbreaks of diseases, like for example cholera. It happens in parts of the time. So we will see that cholera, it's an outbreak, but it's not even continuous, or it has a rising, a gradual curve. This is a conclusion of what we say about the epidemic curves. So we'll see that the point source, it happened in one occupational time. It will have a high peak. We know the common source, so we will try to stop this source, and we will see that there will be no any cases left. The continuous source, we will have one source that can be distributed in a higher place. It will be continuous. There will be no stop for this spread, only if there's stopping this type of source. They propagate it will be by person to person. it's not easily to control uh, the spread from person to person. So we'll see that the this type of infection, it will be spread by generations. It will be get more higher and higher. The intermittent, as we say, there will be no specific time for it to be high or specific time for it to be low. So we will see different type of periods with different types of curves. So the step number 6, which is conduct targeted observations, review key concerns with setting healthcare providers, and develop abstraction forms. So this this step, you need to focus on the staff and how they are doing the infection control practices. So you will see that if there's any different, if the healthcare workers are doing different types of practices. So for example, we need to observe key activities, which is medication preparation, care of vascular access, hand hygiene, adherence to isolation precautions, device and equipment reprocessing, environmental services, and respiratory therapy. These these are related to have a likely to be have a transmission pathway that might be involved in an outbreak. So if these healthcare workers are doing, so you need to observe if the healthcare workers are doing any different practices when dealing with these examples. This is a question that you should ask in this step, which is, are the protocols accurate and up to date? How does actual practice compare with written or verbal protocol? So you need to check how they are doing the practice and what the guideline says about this practice. Are procedures consistently adherent to the protocols? Do instances exist where procedures must be performed differently? Or and we have other healthcare workers being observed to perform procedure differently from protocols. So this is the question is asked for if the healthcare workers are compliant to the protocol. So if necessary, you need to develop and modify and complete the abstraction form. The abstraction forms can include additional details about the patient that provide information for analytic studies. So you can get the information can be collected from the line listing. Step 6, S7, sorry, you need to formulate a test hypothesis. So you should conduct analytic studies. The most common type of study, which will be case control for less biases. However, the analytic study are labor intensive and in healthcare settings not always necessary to identify the likely source of an outbreak and to institute control measures. So uh, the study can help us to analyze and know the source. However, as the note said, the last note, it's not maybe necessary, but it can help to identify the source. What helps also in this setting, you can conduct environmental sampling and testing, and the sampling should be essential to follow standardized protocols to ensure accuracy and reliability. After environmental sampling, you need also to consider testing the healthcare workers. So it is essential because sometimes most of the healthcare workers, even they are being colonized or they are infectious. So you need to be careful before testing the healthcare workers because you should consider three things: is the result will help? Are the results will help in controlling the outbreak? What the duty or work restrictions might need to be applied? And is there any unknown decolonization or a specific way to control the healthcare workers? So step 8, which is implement initial control measures, you should implement full infection control measures that which is recommended by the IPC, and these measures are depending on the type of pathogen and the incubation period of this pathogen. And you should also define the patients who are at risk, and you should also check the healthcare workers and educate the healthcare workers about these measures and how to deal with it. And you should also have a closing location if necessary. Step 9, it's to identify potentially implicated health practices, which is refine the hypothesis. Here you need to consider how to break the chain of the transmission of this pathogen. So what's the things that can help to know the chain is to have a literature review about this pathogen. So for the things that you should focus on this pathogen is the mode of transmission, the source of the pathogen, and the risk factors. So these three main things to focus on. It can help us to understand the pathogen, how it can be transmitted, what is the portal of entry, portal of exit, who are the people at risk. So knowing these things can help to break the chain of the transmission. There's a questions or measures you can ask during the observation, which is what is the if there's an exposure to a reusable instrument, infections associated with indwelling devices, environmental organisms, assessing environmental cleaning and disinfection. So the last step, which is communicating information about outbreaks. So when the outbreak has been identified, it's important to be communicated early and clearly, and the staff, patients, relatives, and visitors should be informed about the outbreak. Also, you need to flag the electronic medical system in certain conditions, such as an MDRO, to allow other staff to deal with the patient using appropriate infection control measures. For the identification process, we have a matrix that can actually help us to classify the outbreak. So once that we declare that there's an outbreak, which is 2 cases or more, and HAI cases, and infected, as the new guideline mentioned, you should notify in the platform after 48 hours. So the report should be tell us what is how the investigations happen, what is the lesson has been learned, and the recommendations to prevent recurrence in the future. All the requirement reports requested from the Ministry of Health should be completed. This is an explanation on when to declare that the outbreak is over. So, for example, when we see the healthcare associated outbreaks, if there are no new cases epidemiologically linked to the relative outbreak or identified within 14 days from the last outbreak case, which is the last case included in the outbreak, should be either negative discharge or deceased. The declaration of outbreak end must be arranged with the IBC. We have also other examples of Ebola. If it's after 42 days, we have MERS-CoV outbreak, which is mainly the period of it is 28 days. Cholera, we have 7 weeks. Meningitis, we have weekly number of reported cases below the epidemic and alert thresholds for 8 weeks. So after we finish the steps of investigation of outbreak, we have the other 4 steps, which is the steps of following up investigation of an outbreak. So the first step of it, which is refine the case definition. So we have a lot of data right now, and we have more accurate details about the definition. So it should be refined so we can identify the cases, and after the investigation it should be more, so as we say, it should be more specific. uh, what will help us is using additional laboratory and epidemiological restrictions. These restrictions help to avoid misclassification. And also the second step of following up, which is we should continue case finding and surveillance. So methods of case finding and surveillance will vary for each outbreak, but may consist of one or all of the following point: prevalence screening, admission screening, discharge screening, retrospective laboratory surveillance, prospective laboratory surveillance, and self-report. These, these ways of surveillance also can help us to identify new cases, and with the help of the case definition. Third step, which is review control measures regularly. When we see that in the investigation, we should educate the healthcare workers, and uh, we should also after we communicate with the visitors and the patients, the measures should be followed. And in this step here, we should also review regularly if the measures are being complied and implemented. The fourth step, which is consider if analytic study should be performed. As we know, the study should be testing hypotheses, not generate them. So the hypothesis has been generated in the steps of investigation. However, in certain situations, collecting data quickly about patients and the comparison group can be a way to explore multiple hypotheses. We have two types of analytic studies: even case control or cohort studies. In more significant outbreaks, a case control method may be the most efficient way of testing a hypothesis. So this is the end of the lecture, and I hope it can help you in the future. So thank you so much.